Hello and welcome to today's online information session about our new, now fully online certificate program in health advocacy. I'm Stan Weisner, the Director of Behavioral Health Sciences here at UC Berkeley Extension and Director of the Certificate Program in Health Advocacy. So thank you for joining me today. I'll start my presentation by telling you a little bit more about the healthcare field and the growing need for health advocates. I'll cover some of the details of the certificate program and some of the outcomes for two of our graduates. And then finally, go over how you can join this exciting career-changing program. I encourage you to submit your questions at any point during the presentation, and I will answer each of them as time allows, or respond to them after the presentation via email. Please bear in mind that some of your questions may be addressed in content presented later in the talk. So let's get started. I hope in this short presentation you will come away with a sense of how important the emerging role and skill set of a health advocate will be to the delivery of quality patient-centered healthcare in the United States in the years to come. This country has entered a new era in the funding, organization, and delivery of healthcare, and it is affecting individuals and families on a very personal level. Medical research and the development of new technologies are affecting the way patients are treated and how services are delivered. Families are often faced with making hard choices about their care in terms of medications, procedures, end-of-life decisions, and an array of treatment options. And partially due to the increased complexity of these often life-and-death decisions, more and more families have increasingly turned to health advocates for advice and support. Electronic health records, telemedicine, new diagnostic tests, home-based care, increased specialization, and the list goes on, are all a big part of what most healthcare systems now provide. The days of home visits, the family doctor, and a soothing bedside manner are long gone for most patients. In terms of demographics, due in large part to an aging population, the number of age-related morbidities and chronic care needs will continue to increase, as will the demands on our healthcare system. Also, in our highly mobile society, where family members across generations often end up living far apart from each other, the need for a knowledgeable, local, hands-on advocate is growing. It is often not clear what insurance policies will cover, what the best treatment plan and medication regime is, especially when there are conflicting advice and unexpected interactive effects, and a second or third opinion is often called for, and what kind of long-term placement and level of care will be needed by a patient. Most managed care organizations and publicly funded service providers, private practitioners, and even health insurance providers want their patients to be as knowledgeable and empowered as possible in order to make the best decisions for their own health care. Having an advocate in a patient's corner can be a big help in this process. So what exactly is a health advocate, and how can a skilled advocate help families make the best decisions when their loved ones are faced with serious illness or disability? While health advocates are not necessarily licensed medical social workers, case managers, or registered nurses or physicians, they can be enormously helpful in pulling together a team as well as the information families need to advocate for themselves. Often patients are seeing more than one physician at a time. They're getting different types of diagnostics. They're making decisions about what types of long-term care facilities to consider for an elderly parent or someone who has been disabled in an accident. The advocate is also there for patients to help facilitate often intergenerational family communication in order to better understand their particular needs and resources. Health advocates almost always work with a team, which can include a range of health providers, insurers, lawyers, fiduciaries, and others to help families make the best decisions for them. So how can UC Berkeley Extension help you achieve your career goals and become skilled and competitive in this growing field? UC Berkeley Extension is the continuing education arm of the flagship campus, UC Berkeley. Since 1891, we've been assisting students in reaching their professional goals and accomplishments. We offer more than 65 professional certificates and specialized programs and more than 2,000 classroom and online courses, with 45,000 enrollments each year. We pride ourselves on academic excellence with courses, instructors, and certificate curricula approved by the UC Berkeley School of Public Health. Our certificates also require academic advisory boards comprising campus faculty and industry leaders who review the curriculum to ensure that it's up to date and in touch with emerging trends and hot topics. Our instructors, most of whom work in the field, also bring their real-world experience to the classroom. So when you enroll in a UC Berkeley Extension course, you're guaranteed a real-world professional education, along with Berkeley quality education. So let's focus on the certificate program in health advocacy in particular, which has been reviewed and approved by the UC Berkeley School of Public Health as a fully online and classroom-based program. As I've mentioned, there's a growing demand for highly skilled health advocates to help individuals and their families navigate the increasingly complex healthcare field. When you couple your undergraduate studies, or perhaps a related advanced degree, with our certificate, you are poised to have an enormous impact on these families' lives. While we don't require a bachelor's degree or an RN degree for this program, we strongly recommend it because it will increase your chances of being employed based on your understanding of some of the broader issues in the health and social sciences. Many of our students also bring with them a rich personal experience, having helped their aging parents or grandparents, or someone with a major illness or disability navigate the healthcare system. As the time that most healthcare professionals have for face-to-face contact with their patients declines, many families will need the services of an independent advocate, an independent voice, to take on the role of patient navigator, case manager, family advisor, or discharge planner. Our certificate is aimed at helping our students gain the knowledge and key skills needed to help people engage more successfully with the healthcare system, or help family members thrive in a residential or long-term care facility. The benefit for those who have degrees or licenses is that you can also receive CE credit for relationship purposes, while at the same time expanding your knowledge base in the healthcare system. Our courses will be a great help for those of you who are currently working as volunteers in the field and are interested in expanding your skill set and eventually perhaps changing careers. Many of our adult students at Extension are career changers and range in age from 21 to 70. As a career changer, you'll get a solid educational background to help you pursue a new and rewarding career. You'll have gained an in-depth understanding of the continuum of care for both inpatient and outpatients in a variety of settings that you might find yourself working in or working with: a rehab setting, a skilled nursing facility, or home health or hospice care. You will also have learned something about the most effective ways to work with intergenerational families and to help them to make possibly life-changing healthcare decisions. You will also gain an appreciation of some of the cost issues and key ethical challenges in the healthcare field. So, in order to complete the program and earn your certificate, you must take a total of 8 required courses, which totals 10 semester units or 153 hours of instruction. 2 of the required courses are 2 units, 30 hours in length each. The rest are 1 unit or 15-hour courses. One is 18 hours. We maintain a high academic standard at UC Berkeley, so we require that you complete each course with at least a C or better. I will add here that most extension students are excellent adult learners who bring their life experiences to the courses and tend to do quite well in their coursework. Most students complete the program in 1 to 2 years. You have up to 3 years to complete the certificate. So let's dig in a bit more into the actual courses you'll be taking. As you can see, they cover most of the key aspects of being a successful and knowledgeable health advocate. One of the first courses you will take is from Joanna Smith, an MSW and MPH, who is our lead instructor, who has worked as a health advocate for many years. Most students who take Joanna's introductory course are quickly drawn into the field with her enthusiasm and skill at sharing her own experiences with her students. There is a course that focuses on health insurance, a critical factor in understanding what's possible cost-wise and what is likely to be covered by public or private health insurance. You'll also learn how to work with intergenerational families in a healthcare context, address challenging ethical issues in the field, learn about HIPAA, and take an important course on how to work cross-culturally with a diverse range of age, ethnic, and gender populations. You're also going to learn to evaluate health information. This is an 18-hour, one-unit course that helps you better understand and screen information for families who might need to make more informed medical decisions. And finally, a 2-unit case seminar on health advocacy throughout the lifespan. This course should be taken toward the end of the program. You'll get a chance to present a case, hear other cases, and pull together the learning that you've done in each of your earlier courses. Each of your instructors, like Joanna Smith, are eager to teach, love sharing their knowledge base, and are all working professionals with hands-on experience in this field. All of them are either PhDs, MPHs, LCSWs, RNs, or MFTs. So they're very current on what is happening in their fields and eager to pass on that information to their students. Each class enrolls about 12 to 24 students, so you really have a chance to get to know your instructors and each other. This is also the case in an online environment for those of you who want to take some or all of your courses online. You can mix and match for those of you who are local. Just to feature a couple of them. Joanna Smith is one of our Extension Honored instructors and is the founder and CEO of Healthcare Liaison, a healthcare advocacy practice in Berkeley. She divides her time between assisting her patients in navigating through complex medical situations and teaching, both at UC Berkeley Extension and in her own credentialing program through Healthcare Liaison. Joanna has 30 years of experience in the fields of healthcare advocacy, mental health, and medical social work. She also founded the National Association of Health Advocacy Consultants in 2009 and organized its first annual conference in 2009. She served as the first president of NAHAC and is the current chair of the association. Elaine Wong-Eakin is an attorney. JD served as the executive director of California Health Advocates. She also served as a program manager and Medicaid outreach specialist for the San Francisco Health Insurance Counseling and Advocacy Program, HICAP. Elaine advocates for beneficiaries to health plans and federal and state agencies. She's a frequent speaker on Medicare-related health care insurance, such as Medigap and CalMedic Connect, and the Affordable Care Act. If you take a classroom-based course, you'll be learning in either our downtown Berkeley Center, which is a couple of blocks away from the Berkeley campus, or at our San Francisco campus in the Financial District. Both locations are easy to get to using public transportation. So you don't have to leave work early to get to an evening class. We also offer some courses on the weekends at both locations. If you want to take a course online, you have two options. Fixed date courses have a set start and end date in the same way as a classroom course. Fixed date courses usually run about 3 months. We also offer ongoing continuous enrollment courses that allow you to enroll at any time and start your course. You progress through the course at your own pace, and you have 6 months to complete the class. Your learning materials are always accessible in the online environment. Group discussions, forum posts, and instructor post questions all provide numerous opportunities to interact with your fellow classmates. You'll learn by reading materials, watching videos, and listening to industry-relevant podcasts, which is further enhanced by interacting with your instructor and classmates. You submit your homework assignments and research projects electronically. Your instructor will provide feedback and grading as you progress through the class. Now, many of you are wondering, what do your graduates go on to do? We're always super proud of our students' success, and many of our graduates keep in touch with us to let us know how they're doing. Howard Crawford completed the certificate in 2014 after deciding to change careers from IT to health advocacy. Currently, he is the co-founder and leader of the UCSF Hepatitis C support group. In this role, he provides information to patients and their families who are dealing with the side effects and adverse events that are common in live transplants. Aaron Markey also completed the certificate in 2014 and is also a career changer from a marketing communications professional to fiduciary services and health advocacy. She says that the inspiration for her career change was from personal experience during her father's battle and passing from cancer. So how do you get started? We recommend that you have a bachelor's degree or some practical experience working with or for the healthcare system. Start by taking a course like the Introduction to Healthcare Advocacy. This will provide you with the basic overview of the field and help you see the big picture before taking the rest of your courses. I encourage you to sign up for our monthly emails. You'll get announcements about courses that are coming up and new blog posts. To earn your certificate, you'll need to pay a one-time registration fee. I suggest doing this after your second course. Once you have registered for the certificate, you will also get access to a website that has upcoming events, announcements, course syllabi, job announcements, and so on. So after you take that introductory course, you can take any of the other required courses. There's no particular order at that point. So please go ahead and take a course or two to see if you enjoy this type of work. If you're intrigued by the coursework and want to pursue the certificate, then go ahead and register. You'll need to complete all of your courses with a C grade or better. The total cost of all the required courses is around $3,400. Probably one of the biggest benefits is that you pay as you go. You don't pay for the entire program at once, you pay for each course one at a time. Our prices vary based on the course. You have up to 3 years to finish the certificate, so you can take it at your own speed. This is geared to our many adult learners who are working or have family obligations that don't allow them to be full-time students. You could complete this program in a semester or two if you have had that kind of time. Once you've completed all of your courses, notify the department to request your certificate. We've gotten a number of questions for those of you listening in that we are hopefully going to be able to answer during this presentation. Here are some additional questions that some of you have sent in. The first question has come in, are these courses and credits transferable to a secondary degree? Yes, they are, and you are earning academic units that are often accepted by other degree programs, but it is up to the receiving organization. UC Berkeley extensions usually travel very well. Another question, can any of the courses be substituted or waived as requirements? No, they cannot, not for this program. Yet another question, I haven't taken a college class in several years. What can I expect in the classroom experience for someone like me? How much homework is expected? As an adult learner with life experience, you will do quite well. Our instructors are very student-centered in their approach to teaching. If you keep up with the readings and assignments at least 1 hour for every hour in class, you should do just fine. Here's another question. Is there financial aid available for students in this program? Unfortunately, no, there is not, since this is not a degree program. You do not qualify for federal financial aid, but private bank loans are certainly an option for many of our students. Another question has come in, does this certificate allow me to get certified as a health advocate? Well, not yet, but a number of national associations are actively moving in that direction to create academic standards and an agreed-upon set of core competencies. This program, while not a master's degree or a one non-credit weekend training, offers a solid foundation to get you started in this growing field. So unfortunately, that's all the time we have to take your questions today. But if you have any additional questions that I wasn't able to answer, here's our contact information. We would love to hear from you and discuss how this certificate or individual courses can launch you into a successful career as a health advocate. So thank you very much for taking the time to learn about our certificate program. I look forward to seeing you in one of our classrooms or online. Thank you very much.